why don't we go ahead and get started, and those that come in, we'll just update them as they enter the room. So thank you for joining us this morning. And if I hadn't said it before, Happy New Year, and we hope you have a great 2022 and be safe and prosperous and abundance of happiness this year. So welcome and thank you for joining us. Again, Luis sent out the minutes from our December 16th meeting. Once again, he did a wonderful job. Thank you, Terry, for chairing the meeting last month. And did you have an opportunity to review the minutes? Hopefully you did. And we can take any questions, comments, or just a move for an approval of the minutes for December 16th.
I'll make that motion to approve, Jack.
Great, Gabino. Thank you. All those in favor of approval?
Favor?
Aye.
Aye. Aye. Great. Thank you so much. All right, we're going to go ahead and turn it over to Gabino, who's going to give us some updates, vaccine education and outreach campaign. Sarah, thanks for joining us this morning. Feel free to add anything you wish to Gabino's comments. And also, we've asked Gabino to provide us with an update on the Cal State University Channel Islands student volunteer opportunity. So, Gabino.
Right. Okay. So, as I think, as we all know, given the holiday season that we just getting over, rates have gone up. 92%, 95% of the cases that are coming up are Omicron cases. So in Ventura County, we have about 80% of the population that's vaccinated, but that leaves 20%, which is about, 20% is about 175,000 people in the county that have not had any vaccination at all. So we just received through the county, and some of us through the state have received some rapid tests, several thousands of those. Sarah can bring us up on that, as Dave Shermer also through the Ventura County Office of Education received, as I recall, about 130,000 kits to distribute throughout the county. Because of the high transmissibility of Omicron, then the recommendation is for all of us to go back to the basics, and the basics have to do with how we started out back in March when the COVID first reared its ugly head. That it was wash your hands frequently, masking, social distancing, sanitizer, no gatherings or controlled gatherings. So all of those things need to be in place again. Some of us, as I understand it, relaxed our vigilance because, there was a lot of, I think, positive effects from all of the work that we're doing throughout the county. But in this situation, because of the high transmissibility of the current variant, that we need to be even more vigilant. So we've talked also about the COVID-19 pill, which some folks are thinking that it prevents COVID. Actually, it treats COVID, but it doesn't prevent it. So the other thing that we've talked about with public health and our health officer at our Monday briefings is that at this time, the movement is not so much toward the eradication of
Se habla sobre erradicar el virus de la pandemia.
Living with a pandemic, which I think is a new normal that we continue to be shifting towards, given that the possibility of new variants popping up around the world is very real. So right now we're dealing with, we started with the COVID-19, SARS, and then we went to the Delta, and now it's the Omicron. And as I understand it, there's one or two other variants on the horizon that are going to be unleashed. So those are like the comments that we have on the part of the pandemic. So, Sarah or Dave, you can add or embellish some of the information that I have provided.
Yeah, just on the test kits, we were really grateful that the state provided those. We got 132,000 test kits, which was enough for every student in the county to get one. And yeah, they were all distributed pretty efficiently, and so glad we could get those out. The other big distribution event we had was N95 masks. The state provided us with 500,000 of those, which have also been sent out to schools. Of course, they're strictly voluntary to use, and they're not great for smaller kids, but for those who want them, including staff, those are available.
Mhm.
I have an update from CDR as well. We thank you, Sarah, and Public Health for the initial allotment of 4 cases of of the home test kits. They've all been distributed. I think Luis or Suzanne, I believe Suzanne, our Director of Education Programs, will be making a second request. Yesterday, we had previously submitted a request for 3,000 kits. We received yesterday a little over about half of that, 1,440 test kits from the Department of Social Services. We're going to plan a drive-by event at our central offices in Oxnard on Saturday, January 29th. Those kits will primarily be targeted and focused on the family child care provider community here in Ventura County. The contracts and provide subsidized child care to children and families in our community. And so our resource and referral staff are now making those plans for that January 29th event. In addition to the test kits, we had requested 30,000 masks, children's masks. That order has not been completed yet, but if we got half of the test kits, we're anticipating we'll at least receive half of the requested amount of children's masks. And when we get those, we'll also have another distribution and planning event to get those out to our clients and our various programs. So that's an update from CDR.
Yeah, Jack, is that drive-by with a PSR test, or is it just a distribution of the rapid test?
Just a distribution at this time. I know that Luis and I have been talking with our program directors about the possibility of hosting an event perhaps in March, but we haven't made that decision yet. Obviously, we want to make sure that we're not duplicating any efforts, and we want to make sure that there's a need for it. So we are continuing to explore that as a possibility.
Mm-hmm. Okay.
I can provide you with an update of how many of these test kits have been going out. So there is a process, and we first started by having those mostly community business organizations, grantees of VCCF from any point. Right now, we're in the second funding, what would you call it, stage, but I'll give you the breakdown of that. So we started by providing you with the form that you would submit to us. Now there's the system is a little bit more automated in the sense that we provide you with a link and a password. Once you go to that link and you submit that password, it brings up that request form. The organizations that we are now providing this link to include social service agencies, private schools, early education that were not provided any test kits from the Department of Public Health at the state level. It continues to include community business-based organizations, and it's strictly only for the over-the-counter COVID-19 antigen test kits, which CDPH has said that while some of our community members may not be able to do or conduct this test on their own and may need some of that support from our promotoras or your promotoras, that they still should be reading the results themselves. So the person who is getting tested, unless they are a child, they should be reading the test test results themselves. So that's one of the requirements of these antigen tests. We have been working with the CEO's PIO office to create the system where people go online on BC Recovers to submit their request form. We then receive those requests. We are asking people to be very specific about the population that they are trying to reach. We want to know the number, and we want to know their plan for how they will be distributing this in the next 5 days after they have received or picked up their shipment. That's really important because we want to get these out to the families. And I know that in the past, because there's this insecurity about not having sufficient supply of anything, that we tend to want to hold on to things. And so it's human nature. We understand it, but it's really important that we just bring the supplies that people need to their hands right away. So those are some of the conditions. So as of January the 3rd, we have distributed more than 15,000 test kits. And so this is as of my report on Tuesday. Since then, we have distributed to another 38 or 37 additional requests have been granted just from Tuesday to today, Thursday. So that's in the last 2 days. But before, since we started on January the 3rd, in total, we have partnered to distribute these test kits with 38 different organizations. Those that encompass all of BCCF funded grantees, and maybe from the time when they were grantees during the census efforts or the initial COVID-19, it's been about 20 of those partners have been part of this distribution. And of those grantees that were funded in the second round, it's been about 12 of them have been very active right now, and those that are funded now. So that's my breakdown. Let me know if you need any other details. Thank you.
Thank you, Sarah, for all your efforts and the update. It's an amazing job on the distribution and partnership. We've also, as you may know, we're communicating with Alicia McFarland, the director of our early childhood programs at VCOE, just to make sure that her requests aren't duplicative. I know that the preschools, our state-funded preschools, I agreed to exclude those from her original request list. And so that way we can make our request directly. And I know, as I mentioned earlier, our director of early care and education programs is Suzanne Godinez will be, if she hasn't made that request already, will be. And so we're working in collaboration with our VCOE partners to make sure that we're going to maximize our casting of our net to our clients so that we're not duplicating efforts. So we really appreciate your leadership on this and partnership. Thank you.
Mm-hmm.
Gabino, did you want to provide us any more information on your updates on the vaccine outreach campaign, or move to the Cal State University Channel Islands?
Yeah, we'll move to the I call it Suchi.
Suchi, okay.
Yeah, I'll move to the Suchi item, and that is that we were waiting and we are waiting for finals to be over and for the staff at Suchi to restabilize themselves for the second semester. So I have not personally had any contact with the person that the head of the business department at Suchi, but Vanessa has been talking to her, and as I understand it, is setting up a meeting so that we can nail down how we can have student volunteers working with our Vax campaign, with a couple of other campaigns. So as I understood it, some of them would like to do work that is similar to what promotoras are doing out in the community. So we have students that are at CI from all over the county, and some of them want to go back to their neighborhoods and do that quote unquote promotor work. And then also these students have a variety of skills, some of those having to be in the marketing area, being business students. So I'm anxious to enlist, 2 or 3 of them on, some of the projects that we're working here through the foundation. So Terry, I don't know whether you have any further information on that, but that's what I have.
Yeah, I have had a few conversations and it hasn't really moved forward at this point. I think that what they're looking for is a broader definition of what you need. Like, it's really helpful that you mentioned that you need 2 to 3 volunteers. That's a very helpful piece to understand whether we're looking for 2 to 3 very dedicated people, or we're looking for teams to go out and canvassing or something. So yeah, I thank you.
So we'll await that meeting with Vanessa and the head of the business department.
I don't think Vanessa talked to me. She hasn't talked to Susan. I've talked to Susan, and there are possibilities for it to move forward.
Yeah.
So, yeah.
Very good.
I think there's also possibilities of perhaps moving outside of the business school as well, and other departments might be interested. I understand that, but again, it's so preliminary at this point. Is that correct, Terry?
That's correct. We can't really move forward. The school can't move forward and designate the entity within the school is going to be responsible until we have a better understanding of what we would like the students to do, either for the COVID outreach or the other outreaches.
Okay. And I know the other 2 initiatives, Gavino, that you were considering was the enlistment of organizations to sign on to the Children's Now movement.
Yes.
That was one that you had briefly mentioned previously. And then the other one was the efforts for the Universal Preschool, Universal Transitional Kindergarten pilot for Santa Paula.
Yeah.
Correct? Are those the 2 initiatives that you previously
Yes.
mentioned?
Yes.
Like to explore? And I think
Yes.
I think Terry's suggestion in terms of, start thinking about a description for each one of those particular initiatives, I think would be helpful also for some clarity.
Regarding the children's movement, essentially that's a recruitment effort. The children's movement as an organization has right now 4,000 members, and the foundation is committed to adding 100 organizations from Ventura County to that list, to that network, and primarily focused on minority and marginalized communities and population areas in the county. So essentially, the Children's Now and the Children's Movement, for those members that are recruited, provide great research on legislation and initiatives that are coming up. And then from there, they send you all the information, and then it's an opt-in for each organization. If a particular legislation that is pro-child is on track and it fits within your mission as an organization and your values as an organization, then you can choose to opt in to advocate for it. And what that advocacy entails is contacting your legislators to expressing your support for that particular bill or that particular initiative. So, it is, I think it's a win-win for everybody. The community is kept in touch with what's currently going on in government levels. And then the opportunity to become a quote unquote pro-kid advocate is there. So given the needs of not only the children, but the families of the children that are involved in education, I think is something that needs more attention and more advocacy. And when you look at the level of support, financial support for families and children, especially of low income, we're like out of 50 states, we're like 35th in that level of support. So we have a long ways to go. And with all the rhetoric that comes out of Sacramento, you would think that everything's hunky-dory, right? That everything's okay, but you know, the children's movement just came out with their report on children for 2022 that is really alarming. So if
We
you're
also-
interested, I
Yep.
can send that to you.
That'd be great. And
Yeah.
I think it's a great idea to get 100 more organizations signing on to the children's movement,
Yeah,
obviously for the reasons that you stated. I do know that CDR is currently a member, and you're right, when there's important legislation, and it's not just childcare, it could be food insecurities,
yep,
programs that end poverty for children, at least is their mission. And they create these templates that are so user-friendly. It takes virtually less than 30 seconds to sign on to an important
Exactly.
issue. So great. Thank you for that update, Gavino.
yeah,
Gabino, one thing
Yeah.
that's really helpful is I really appreciate your overview on the importance of this. That is incredibly important, and that needs to be, if you could put that in a little email that I could send, but also in addition to that, like a job description for these volunteers.
Yeah.
So we'll know, like, how many do you want? What are they going to be doing? Are we talking about, a job description? That would be
okay.
great. So we know who to target, which departments to target.
Yeah, I will
That would
do
be
that for
wonderful.
the project that we're currently working on.
Great.
Great. And then once I give that to the school and they say yes or no, we're interested, then I will set you up with a contact,
Yeah,
as long as they
Okay.
decide to go ahead, but they don't have enough information to act. So I think that it's prudent to do it now. Everybody's back in school. That'd
yeah,
be
well,
really
I had been hoping that we would be able to have a face-to-face with staff from Suchi, but I guess the
You can, I'm sure,
information, yeah,
they need more information, but you will be able to have it face to face or at least over Zoom, for sure.
yeah,
Absolutely.
we'll
Yeah.
do. All right,
All right. Thank you, Gabino. Appreciate it.
yes,
Yeah, thank you very much.
CBO updates. I don't know, Dave, if you want to add anything else, you did share with us on your efforts for the test kits and the mask. Anything else you would like to share with us with regards to BCOE's efforts?
Yeah, one other thing, I'm sure you all heard that everyone can order, and everyone in the country can order test kits through the post office website now and get, I believe it's 4 kits per household. And luckily the website is pretty simple and it's in English and Spanish. But we realize there's a large number of people in the community who still may need help completing that. So Consuelo Williams here in our office is reaching out to her partners, some of the nonprofit partners, on ways to have opportunities where we can support people filling out that form. I don't have a lot of the details of what she set up, but I know that's something she's working on.
Great. We also, that's a nice reminder for me as well, Dave, that this morning our health and benefits specialists in our HR department, we sent out some information to all 385 employees regarding Kaiser and Blue Shield health plans. Those are our health benefit insurance companies. Information regarding reimbursement of rapid at-home antigen tests. So those that are on our health plans, they can get reimbursed for if they choose to purchase those. But in addition, as you mentioned, Dave, we also included the information on the free rapid home tests without any shipping fees from the federal government. And we provided the link this morning to all the employees, encouraging them to use the very user-friendly link to request some home test kits if they desire. So that went out this morning.
Yeah, that link is really easy to use. If you guys have not used it, it takes 15 seconds. It's really nice.
I also wanted to share with you, although this is not in the realm of vaccine outreach and education, But I received an email yesterday from Dr. Bill Simmons, and Bill is with the Broadband Consortium for the Pacific Coast. And he's leading an initiative with Bruce Tinsley from the Economic Development Collaborative on an initiative for Ventura County broadband. And so he reached out to me yesterday requesting assistance in collecting input necessary for developing broadband strategies in Ventura County. While they have been very successful in collecting feedback from businesses and our local municipalities and key stakeholders, they have fallen short, unfortunately, in the areas of education and healthcare. And so he was asking for our assistance and or feedback. That email was then followed up by one of our subcommittee members, Nancy Schramm from the Ventura County Libraries. She sent out a beautifully written email that went out to all library, education, and or healthcare leaders in Ventura County, briefly explaining the broadband initiative and including a survey link that she's asking them to please take a moment to complete the survey. So I asked for her permission if we could send out her email that includes the link to the members of this subcommittee for their possible consideration and, more importantly, completion. So following this meeting, Luis will send out the email to all the subcommittee members with a little background information, and we're asking for you to share that information with your your internal folks at your respective organizations and see if we can complete the survey so that they can get some more data from especially the educational institution community here in Ventura County. So that's forthcoming. We'll send that out later today.
A question on that, Jack. Is that broadband initiative to provide access to everybody in the county or low income individuals, families, or?
You know what? I don't have any of the specifics information, but we'll include, I did send an email to Bill this morning, letting him know we were going to share this information. And if it was okay to include his email as well as his mobile cell phone number that he had listed in the original email I received yesterday. If he does that, we'll make sure to include that in the email. That way, if anybody has any specific questions about the initiative, he can respond.
Yeah. It seems like universal means universal, right?
Right.
You know, I mean, when you start to divvy up the population based on certain criteria, then it becomes dicey. And you know, the internet access is supported heavily through advertising now. So it seems like, you know, it should be just offered to everybody straight across.
So looking at his email, there's a paragraph here that says, this is an initiative from the Southern California Association of Governments, CCAG, and the Broadband Consortium of the Pacific Coast. Their acronym is BCPC, and they're conducting a study to determine the extent to which the availability of ubiquitous broadband could decrease vehicle trips and in turn reduce greenhouse gas emissions. The study examines the potential of broadband as a green strategy to reduce impacts on the environment if every household, business, government service, and community facilities were connected to the internet with high-speed service. So that's
wonderful. Yeah. Well, we've gotten a taste of, you know, virtual work. So some people find it very convenient, and it is very convenient. And so I think similar to talking about the new normal with COVID, you know, it seems like this is one of the things that is going to be difficult to turn back, you know, especially when we hear that some folks are really not wanting to go back to work, quote unquote, and find it easier and equally effective to do their work virtually.
Well, it's a great opportunity to get the word out about the initiative and give an opportunity for our key stakeholders to provide a response. So Thank you in advance for your assistance in completing the survey. We'll be completing the survey by the end of the day tomorrow for CDR.
Well, VCPC, easy peasy.
I noticed in the chat that Sarah put us a link here as another resource for ordering the home test kits from the National Association of Community Health Workers. Thank you, Sarah.
Mhm.
Any other updates? It looks like we're going to give the gift of time. We're only a little into about 30 minutes of the meeting, but before we adjourn, just wanted to give anyone an opportunity to share any information and or announcements. None?
Looks good to me.
All right, we get the gift of 25 minutes of time. I'm sure we could all use it. So again, thank you. Our next meeting will be
Thank you.
February 17th, 9 a.m.
Thank you.
All right.
Thank
All
you
right.
all. Thank you very much. Have a
Thanks,
great
Sarah.
evening.
Bye.
Sarah,
you.
could you
Bye.
give me a call so we can talk about Carmen, Sarah?
Mhm.
Okay, thank you.
Bye-bye.
Adios.
Thank you.
See you
Adios.
later, Jack.
Adios.
All right, adios.